Coming up, we will be on location at Sunrise Orthodontics in Reston, Virginia, discussing the latest advances in orthodontics and how they can help straighten your teeth and give you the smile you've always desired with one of this region's top orthodontists, Dr. Liliana Calkins. Dr. Calkins received her DDS degree from National Autonomous University in Mexico City and has completed postgraduate education at Howard University in Washington, D.C. Dr. Calkins has over 14 years of experience and is a member of the American Association of Orthodontics and the American Cleft Palate Association, among other organizations, and she is widely recognized as one of this area's top orthodontists. Welcome, Dr. Calkins. It's a pleasure having you on our program.
Thank you for the invitation. It's a pleasure to be with you as well.
It's your first time, in fact, on the Top Doctors Medical Interviews. We have a lot to talk about. We have a patient that's going to be joining us a bit later. But I wanted to begin, if I may, Dr. Calkins, by asking you if you can please tell us what some of the latest advances in orthodontics are and how we can benefit from that.
The benefit that our industry is giving to the patients is computer-aided diagnostics, computer-aided digital orthodontics. That basically means that our patients get customized appliances that are tailored to their specifications. We are moving into higher efficiency and control of quality standards thanks to that computer-aided diagnostic imaging and bracket systems.
My goodness, so basically through the advances in technology, there are advances now through all this and the computers and everything else that you have, because you have a state-of-the-art beautiful office, certainly like futuristic. I mean, it's gorgeous, and certainly the patients as a result get these benefits.
Absolutely. Sunrise Orthodontics invested heavily in the latest technology in our industry, from digital scanner to completely integration with the standards of office integration management and imaging, computer graphics. Through these concepts, we are able to diagnose the patients, and that as a doctor allows me to have complete control of what I'm viewing on my patient and where I want to go in direction of treatment. And that's also shared with our patient. Our patients, thanks to all this digital technology, are able to visualize the results even before we put any appliances in their mouth.
My goodness, how things have changed.
Yes,
for the better.
That's right.
Now, what types of dental problems do you frequently see as far as patients when they come to you?
We have a wide range of different situations. My philosophy is based on foundational occlusion. I might be one of the few orthodontists that takes a great deal of time in comprehending, understanding where our patients are standing in their terms of conditions. We see ranges from teenagers to adults to comprehensive treatment with adults that need rehabilitation. So it's a wide spectrum of different challenges, and we are on board to meet the patient demands and needs.
And as far as some of the treatments that you offer, can you tell us a little bit about them?
A lot of the treatments that we offer at Sunrise Orthodontics are technology-driven. One of the biggest companies that sponsors us is based on California, is Ormco, and through them we are able to implement Insignia, which is a computerized aided diagnostic system and digital orthodontics that allows us to bring high-quality treatment to our patients. We also offer other trends in the industry like clear aligners, and all our bracket systems are tailored with the best standards in the industry to facilitate movement, make it fast, comfortable, precise, and predictable for our patients.
And I would think a treatment such as clear aligners would be perfect for so many busy folks out there, professionals out there that are watching who need some work done but don't want people to know that they have things in their mouths, helping them.
Absolutely. We have different alternatives, not just the clear aligners, but we also are providers of invisible lingual orthodontics. So we have a wide range of different possibilities for the adult community. There are around 23 million Americans, adults, that would benefit from orthodontic treatment to improve their oral health and have a smile for the rest of their lives that they will be comfortable with.
So I would think, Dr. Calkins, there are numerous benefits just by the fact that you have a fully state-of-the-art equipped office, as you've touched on and elaborated a bit on, that would offer benefits that the traditional offices that aren't as high-tech as yours aren't able to do.
That is correct. Technology is allowing us to be predictable and precise. And we also prescribe Acceleron to our patients. This particular product reduces treatment time up to 30%. So we can help our adult community and our teenagers not just with more precise treatment options, but also with faster treatment options. And that will be a great benefit from them.
Yes, it is. You're absolutely right. People want the results and they want it quicker.
That is
because
correct.
of how busy everybody is. Now, speaking of results, what type of results can we expect from the treatments you offer here at Sunrise Orthodontics?
My best efforts are focused on excellence and quality. I want our results to be not just predictable, but maintained throughout the span life of our patients. And that is achievable through thorough understanding of diagnosis, treatment plan, and execution of that treatment plan.
We're now going to meet a patient of Dr. Calkins. Welcome, Tina. It's a pleasure to have you on our program.
Thank you. It's a pleasure to be here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, Tina, I just wanted to begin, if I may, by asking you if you can please tell us what brought you to Sunrise Orthodontics. Were there any dental problem or problems that you were experiencing?
Yes, I was having some fairly major TMJ problems, which manifested with daily headaches, pain in my left side of my face and my ear, and my jaw slipping out of track while I was talking. So I was having trouble chewing and was starting a liquid diet that it was so severe that I couldn't eat much anymore.
My goodness, so you're talking about some major problems that were clearly affecting your life at that time.
Yes, very much so.
So then what happened? You came here to Dr. Calkins, and what took place?
Yeah, she did a very thorough history and was very meticulous and detail-oriented with diagnostic work that she's done. And she really paid attention to the details of what's going on in the joint itself. We still have a little bit more diagnostic work to do, but she's been extremely caring. I would definitely recommend anyone who's having any similar problems to see Dr. Calkins. I've been very impressed with her approach and her thoroughness and friendliness and kindness.
Now, before I let you go, Tina, I wanted to ask you if you can please tell all the viewers that are watching about your experience with the staff here as well at Sunrise Orthodontics.
The whole experience has been wonderful from the day that I first called and had my first interaction with the receptionist to the time I walked in the door, and every interaction and has been wonderful. It's been great.
On that note, I'd like to thank you, Tina, for coming down and sharing some of your experiences with us and being a guest on our program.
Thank you very much.
It was our pleasure. We're back with Dr. Calkins. You're doing some great work on Tina. She was really suffering prior to coming to your office, and as she just told us a few moments ago, she's already feeling a lot better and very pleased with not only the results thus far, but the experience with all of you here.
We are very blessed to have the trust of our patients, and my efforts are likewise to make them feel comfortable and appreciated, and that they will be in good care in our hands. Our industry is formidable with beautiful practitioners. I have been trained by the best minds in the industry. The Professor of Foundational Occlusion, Dr. Mark Piper, Dr. Jim McKee, and the FACE group, Functional and Aesthetic Excellence. All our professors guide our mind and clinical protocols to better serve the patients.
Very interesting. Quite an impressive depth of experience from some of the best in the industry, indeed. Now, who would you say, Dr. Calkins, would be a good candidate that can benefit from all the different services and treatments you offer here?
Our best candidate is the patient that wants to improve their oral health, that will appreciate being educated by my team and by our professional resources. Every patient is welcome at Sunrise Orthodontics, and the time is now. I would invite every patient that wishes to improve their oral health to come and visit us and expect the best from my industry.
Now we're almost out of time, but I wanted to ask you a couple of more questions. One is, you and your practice, Dr. Calkins, Sunrise Orthodontics here in Reston, Virginia, have certainly established a reputation for excellence in orthodontic care, patient care. And you certainly have a state-of-the-art office. It's about as high-tech as it can get. I mean, it's really gorgeous. I just wanted to ask you, what would you say helps separate you and your practice from many of the others?
Sunrise Orthodontics invested heavily in the latest technology of the industry, from our imaging system, the PlanMeca, our digital impression system, and how we integrate with different providers to make the treatment flow for the patient easier. We are very fortunate in this area to have amongst the best providers in orthodontics. I invest heavily myself in education. Being trained by the best minds in the industry, our education is for the patient and will benefit the patient. And I will keep training my team and provide the standards of care that will bring comfort to our patients and reinvent ourselves. Our industry is about reinventing the profession through technology.
Fascinating. Not to mention that you're one of the very few orthodontists in this region that also specializes in helping folks with TMJ problems. For example, Tina, the patient we interviewed a few minutes ago, she suffered from TMJ prior to coming to you.
That is correct, and it is thanks to the access that we have had in education by Dr. Mark Piper, Dr. Jim McKee, and the elite group of the Dawson Academy. I keep training myself closely with them, and it's thanks to these beautiful minds that we can bring their care to our patients.
Now, lastly, our research has shown that you're a big believer in giving back to the local community here in Northern Virginia. You're involved in numerous endeavors. Can you please tell us a little bit about some of those?
I was very fortunate to be mentored by Dr. Eric Kotlik and Dr. Donna Grant-Mills from Howard University. They were my pillars in community service. I love art and poetry, and I believe in supporting education at our local schools. Currently, my facility offers a year-round gallery of art created at Lake Anne and Langston Hughes. We are also partners with the Greater Reston Arts Center and the Chamber of Commerce. All our efforts are towards supporting and sponsoring our little artists. We do public galleries at Sunrise Orthodontics every quarter, and our kids bring their families and they feel very happy of being able to portray their art in a public environment. We also participate at the National Oral Health Program sponsored by Patterson, a partner of ours. And through that program, we're able to participate in Full Force Miles. Our program targets local schools, and we invite children to donate their candy here at our facility in exchange of smile-friendly products. In that way, we keep their nutrition and their oral health in better circumstances.
Well, that is really something else, what you're doing and your involvement that goes far beyond helping so many folks that come here to Sunrise Ortho, but your involvement is helping so many more folks. And I want to thank you so much for joining us, being a guest on our program. I can certainly see why you're very unique in so many ways.
Thank you, Roque. I appreciate it.
It was our pleasure having you on, Dr. Calkins. We'd love to have you back on in the future.
Absolutely. Thank you for the opportunity to be with you.